saving lives and creating the awareness that every child matters has been a strong statement World Vision Sierra Leone Health Aim project is carving out in the hearts and minds of the people of Bont District, Southern Sierra Leone. As the world continues to strive towards reducing maternal mortality and improve child health through digital health innovations, over 30 health workers have received training on ComCare health systems. Safa Andrew Kurma is the country health and nutrition advisor, World Vision Sierra Leone.
The training we are conducting in Matrijon is training of trainers for community health workers, translating digital health into day-to-day, timely, efficient, and effective health outcome intervention within the maternal and newborn child health project in Bont District.
The question many experts will be asking is whether World Vision is plying the correct route when it comes to digital health programming. Andrew Ogongo is the World Vision Global Center ICT4D Program Manager. Andrew provides support to national offices seeking to implement digital health programs.
I like the working partnership that the World Vision has with the Ministry of Health and even the health facilities and other partners around. I think that actually reinforces the fact that through partnership, World Vision could be able to realize scalability and sustainability of the mobile projects. A number of countries, this actually has not been the case. The Ministry of Health has been dragging quite a lot. Some of them still do not actually have the value which ICT4D could bring into their programming work. But I like this idea of that partnership working approach adopted here in Sierra Leone.
World Vision is ensuring that all its programs' implementation are in line with its global strategy. Yet, how does digital health innovation links into the current World Vision ICT plan? Is the question World Vision's Ghana and Sierra Leone Hub IT Manager, Christian Bongo Johnson,
I think it's remarkable.
Credence
and it speaks to the our promise 2030 in World Vision that we should find innovative ways to meet the needs of the children. And I must tell you that since we started the AIM Health and the M Health in Bont, we have achieved 100% hospital delivery. And that was one of the outcomes we are looking for, because home delivery is still a challenge in Sierra Leone. And if we can have this project with the use of technology alleviate such, I think it's a plus that we should applaud.
For such a project to survive the test of time, collaboration is key, and collaboration with the national government is a must. Albert Vande is working at the Government of Sierra Leone's Community Health Workers Hub in the Primary Healthcare Directorate. Albert is the regional coordinator of the Southern region.
Vision has been collaborating with the DHMT because they are in Bont here, and they have been collaborating with the DHMT, in fact, since 2015. When I was here, when they started that ComCare program. So it has been working very well. I think they are collaborating because they have been working directly with the DHMT.
If you look at the composition of this training today, you have more of the Ministry of Health and Sanitation Sierra Leone staffs in this training. Two things. We are talking about sustainability, and we're also talking about partnership. For us in World Vision, we believe that we are supporting and promoting the effort of the Ministry of Health. And therefore, we believe that they take the lead. So, our partnership with the Ministry of Health is critical in this intervention. And therefore, we ensure that they are part of the process from the beginning to the end.
In Bont District, we have healthy relationship with all ministries and departments operating in the district. As it relates to Ministry of Health and Sanitation, we have a representative, a World Vision representative, Josie Musa, who is a project manager for AIM Health Plus, represents World Vision, within the district health management team.
Now that the government's regional coordination team and World Vision health technicians are working in close alliance, Ibrahim Sori Kurma, the health education officer in the Ministry of Health and Sanitation, believes that a pilot project is essential.
It's a very good idea, because Sierra Leone, in terms of health, we still have problem in data processing, data gathering, data reporting. But with this ComCare training, I do believe it will help in the area of maternal health, child health, even from the community level up to the DHMT and also national level.
Health practitioners who took part in the training also underscored the importance of the training towards the work they do in the pilot district.
Especially because of the terrain we are working here in Bond, the riverine and other areas. It's very difficult for us to even have reports from those facilities that we are working with. So this one will serve as something that will really help us, especially in terms of reporting. Because this time you don't need to call facilities or you don't need to write on papers to send them. At the end of the day, maybe they will get missing.
In terms of reporting, it's a very difficult issue in the health system. But bringing on board our CHWs who are working in line with us in order to identify conditions that may lead to complications and even deaths, bringing these reports to us at the early possible time will help the M&Es to be able to collate these reports in a very short possible time and then analyze them to see where there are difficulties or issues that they may tend to address in the shortest possible time so that we may combat the situation wherein we improve the health of our community.
Children are considered to be national assets. Therefore, the AIM Health Project Manager, Joseph Musa, believes that the children's stake in the entire digital health project should be emphasized.
When we look at the project's outcomes, I can relate it to like two major outcomes. That children are protected from disease and injury, and then children and our caregivers are able to access health facilities when they are ill and be treated appropriately. So the training of this type can do so much that because if the community health workers are able to use the mobile phone and they are able to track the children and their mother in time, that will help to reduce the maternal or infant mortality.
The government representatives and participants carefully studied and accepted that digital health is of great importance to the country's health development. Yet they stopped at nothing to ask the question how efficient and sustainable the project will be. That question could only be answered by Andrew Gongo, the World Vision Global Center ICT4D Program Manager.
In countries actually where it has been implemented, like Uganda, there's been a lot of positive improvement, where you find that the mortality rate actually has drastically reduced, where in cases where it was not implemented yet, you find that it was even as high as 30%, but with the implementation of this, with good monitoring and providing evidence-based, the government actually in a better position to plan how they could actually be able to intervene at the right time. This actually has, in a lot of cases, I would give an example, Uganda, I'll also give an example of Tanzania, has drastically reduced mortality rate for the children. And even you find that the awareness in terms of mothers, how actually they could take care of the baby, actually is much improved.
It is believed that when the implementation is completed, the government of Sierra Leone will own the process and cascade to other regions to improve the Sierra Leone healthcare system, to assure pregnant women, lactating mothers, and above all, children, life in all its fullness.